Hello, my name is Priya Gupta, and I'm going to be discussing the causes of malnutrition in patients with chronic kidney disease. Before we discuss the causes of malnutrition and go into some information about chronic kidney disease specifically, I want to give a brief overview about what malnutrition is. According to the American Society for Parenteral and Enteral Nutrition, malnutrition is most simply defined as an imbalance between nutritional requirements and nutritional intake. This imbalance can result in deficits of energy, protein, and micronutrients in the person. In the general population, malnutrition is frequently caused by low food intake or just poor diet. In patients with chronic kidney disease, or CKD, malnutrition can definitely be impacted by those two factors, but it's also impacted by a variety of other factors. And these include hormonal imbalances, suppressed appetites, inflammation in the body, increased catabolic rates, and nutritional losses due to dialysis, a common treatment for CKD. A related concept to malnutrition is protein energy wasting, or PEW. According to the International Society of Renal Nutrition and Metabolism, this is defined as a state of decreased protein and energy fuels, or fat. And in people with chronic kidney disease, it's caused by a lot of the same factors as malnutrition. So someone with chronic kidney disease who is malnourished may also be in the state of PEW. Now that we've discussed a little bit about what malnutrition is, I'm going to give a brief overview about chronic kidney disease. Chronic kidney disease is defined as abnormalities of kidney function and/or structure that persist for over 3 months and have implications on one's health. This condition has a prevalence of around 14.5% in adults, meaning it affects around 20 million adults. Chronic kidney disease can be caused by or related to other conditions, including diabetes, hypertension, and obesity. The progression of chronic kidney disease is divided into 5 stages. Stage 1 is the first stage, and Stage 5 is the last. Stage 5 represents kidney failure, and at that point, the person's only treatment option is typically to receive a kidney transplant. Understanding the relationships between chronic kidney disease and malnutrition is very important because these two conditions form a cycle. As we're going to discuss, chronic kidney disease can lead to malnutrition through multiple pathways, but in addition, malnutrition can also worsen chronic kidney disease. So it's very important for someone diagnosed with chronic kidney disease to not only ensure their chronic kidney disease is under control, but also to maintain proper nutrition. These are some causes of malnutrition, specifically in people with chronic kidney disease. The first of these is hormonal imbalances. People with chronic kidney disease tend to have increased levels of insulin and leptin, and this leads to decreased appetites. So this is one of the main causes of malnutrition, suppressed appetite leading to lower food intake, which means lower nutrient intake. The second cause here is metabolic dysfunction. People with chronic kidney disease may have an upregulated ubiquitin proteasome system, and this leads to metabolic acidosis, and this can also lead to malnutrition. And the third cause here is inflammation. People with chronic kidney disease have increased levels of inflammation in their body, and this inflammation is always present. It's chronic, just like the disease, and this also can decrease appetite even more than the hormonal imbalances. So those two things work together to suppress the person's appetite, which can then lead to malnutrition. Here are some more causes of malnutrition, again, specifically in people with chronic kidney disease. The first of these is altered microbiomes. So people with chronic kidney disease have been found to have altered microbiomes in their gut, and this can generate toxins. This can sometimes lead to decreased appetite, or it can just decrease the nutrient levels that they get out of the foods they eat. They can also have gastroparesis, which affects the motility of the muscles in their digestive tract, and this again decreases their nutritional intake. And finally, dialysis, which is a treatment for chronic kidney disease, can lead to higher levels of inflammation in the body. And as we discussed on the last slide, that level of inflammation can decrease their appetite. Dialysis can also lead to higher levels of protein muscle breakdown, and that again leads to that increased state of PEW. There are a few different treatment options for someone with chronic kidney disease who's also found to have malnutrition. A few of these options are preventative, and some of them are more severe treatments if the malnutrition can't be controlled with only changes in diet. In order to achieve proper nutrition, nutrition counseling is usually needed and is often the first intervention tried. Once a person becomes severely malnourished, it can be very difficult to treat and restore nutrition. As a result, nutrition counseling should be provided very shortly after the diagnosis of chronic kidney disease whenever possible, and this is to prevent malnutrition from setting in the first place. Nutrition counseling in people with chronic kidney disease focuses on ensuring the person has adequate nutrition in their food intake. Common suggestions for people with chronic kidney disease include switching to a vegetarian diet in order to reduce their phosphorus intake and increasing their vitamin B6 intake. If these things can't be done with their food alone, they may consider adding vitamin supplements if needed. If this change in diet is unsuccessful in improving their nutrition, other interventions might be needed. These vary greatly depending on the stage of chronic kidney disease, the severity of malnutrition, and what other treatment options the person is undergoing, but they typically include enteral food feeding and possibly adding nutrition through dialysis sessions. And here are the sources used for this presentation. Thank you.